Many careers in computing have begun with frustration over previous technology. Sorting 18,000 IBM cards in 1968 on a card sorting machine was quite an experience, one that prepared me to appreciate microcomputers when they came along. This is a McBee card used in the Burkitt's lymphoma study, which operates with a set of knitting needles. In the pod surveillance system in Minnesota, we wanted to input the data, and the only way to do it was to point a medical student in the direction of SPSS, and after a while he became capable of doing the processing. In Arkansas in 1976, I had decided to build my own computer, and here's the setup that I had in Minnesota, which was not really useful except for learning, but it was a start. I organized something called the Computer Working Group of the Conference of State and Territorial Epidemiologists, and together with representatives from CDC, we developed a plan. Like many such documents, it remained a draft, but it spelled out the development of easy-to-use software for disease control and an outline of a national surveillance system with electronic transmission of data from microcomputers at the state level. I was offered a position at CDC to help implement the plan, and my son Jeff, who was then a junior in high school and is now a senior distinguished engineer at Google, and Tony Burton and I developed what became Epi Info. Consuelo Bexaguet was one of the first people to test it during an outbreak in Fort Lauderdale. This is version 2 of Epi Info for DOS, which we copied by hand and distributed from our office. Here we have the staff of the surveillance and Epi Info groups and the translations that were eventually done of the software. In the 90s, we began developing Epi Info for Windows with a staff that was more adequate. Denis Colombier contributed many ideas and several software modules. Robert Fagan provided assistance to states, and Richard Dicker helped greatly with the design of the statistics. Since 1994, Epi Info has been distributed via the internet, and more than 1 million copies have been downloaded. Classes have been taught in numerous countries around the world. I received the prestigious Pump Handle Award from the Conference of State and Territorial Epidemiologists, which actually comes from a Texas hardware store. In 2002, I retired from CDC, and Kevin Sullivan at Emory University and I began developing a program called OpenEpi, which is for statistics with summary data. OpenEpi is an internet program which has now been included with Epi Info. In 2004, Consuelo and I went to the Dominican Republic as volunteers in an HIV clinic. Here I wrote a program in Epi Info to calculate the doses for antiretroviral medications. These medications perform miracles with patients who had HIV. And 4 months later, you see Juan looking strong as an ox. In 4 years, we saw the clinic grow from about 200 patients to 1,500, and the installation of a complete electronic medical record system based on Epi Info. The laboratory acquired a CD4 counting machine, and staff were trained to use it and produce CD4 counts. We returned to Miami in 2008 and published a book which is available online for free and from Amazon.